Nurses and doctors of Reddit, what's your weirdest / scariest paranormal story that took place during work? There is probably some medical explanation for this, but still the weirdest thing I've seen as a nurse so far. We had a very robust, confused old lady on our floor. Her room was in front of the nurses' station so we could keep an eye on her, and one of our nurses aids her as a sitter too. She was always fighting, kicking, trying to get out of bed. Very restless and agitated, as some patients I've had before can get before death. One day we were called into the room as her heart rate was going down and she lay still with her eyes open. It was 30, 20, and flatlined. We checked for a pulse and did not find any. She was a DNR, so we did not attempt resuscitation. We closed her eyes, prepared to get the body bag, and called the family. The sitter remains in there to start getting the body ready. Less than 10 minutes later, she calls us back. The old lady is at it again, hitting, kicking, trying to get out of the bed. She came back to life. Honestly, we found the situation hilarious, and I still have never seen any patient come back to life like that on their own. I think she made it out of the hospital too. Oh my god. I've worked in a small family-run nursing home for 6 years as a nurse aide. It was an orphanage before it became a nursing home, and unfortunately before being shut down the orphanage had a history of severe abuse and neglect. Unfortunately, it's not gossip the owner herself has told us. When residents get close to death, they always see a little girl. One of my patients was a very alert gentleman. He knew all of our names and was very alert and oriented. I was passing dinner trays and saw that he had his back turned and was talking and laughing in the corner. I knocked and asked him who he was talking to, and he chuckled and said, "This little girl comes into my room. She was scared." He died 3 days later. About 6 months later, we had another patient screaming about a little girl grabbing his feet, and she needed to leave him alone. He died that night. She comes up over the years. It's always the same thing. They see her, and then they die. Other co-workers have had the same experience. It's very unsettling. That actually sounds like a nice story to me. A little girl who never had a family keeps these people company as they're nearing death. I want to see a movie like that, except I feel like it would turn into a horror movie by the end. Sounds like one at the start. I worked in a pediatric hospital and had always heard that the 4th floor right outside our oncology unit was haunted. I worked 3/12s normally, but would pick up overtime and pick up a night shift. I was working in the NICU, which happened to also be on the 4th floor, but on the opposite side. The oncology unit had a staircase that was a shortcut down to the cafeteria, which was on the 2nd floor. At about 3 AM, I was ready to take a short break and wanted a cup of coffee from the cafeteria, so I decided to take that staircase. I walked through the automatic double doors and saw a kid skipping down the hall. I called out to him as I was afraid a little kid had snuck out of a patient's room. As soon as I called out to him, he turned and in the blink of an eye, totally vanished. A lot of other nurses and docs have seen the same little kid skipping in that same hallway. Of course, I chalked it up to just exhaustion and didn't really think about it much after that, but you are damn sure I didn't use that hallway at night, ever again. I'm an ICU nurse. A patient's son rang the hospital at 11 PM on a Saturday night saying he was sure his dad was dying. His dad had had a severe stroke and was doing okay. Recovery would be difficult, but he wasn't expected to die and was pretty stable at the time. I was looking after him, and he was a lot of work because he would try to get up but couldn't walk, so he'd fallen a lot. The son really wanted to come in, even though it's way past visiting hours, but I'll bend the rules in a good cause. I figured, what the heck, it's his Saturday night. Come on in and sit with your dad. Patient died about 2 minutes before the son walked in the door. It was like a switch was just turned off. He just died. The last thing he said to me was, "Am I bothering anyone?" I told him of course not, even though he had some very frustrating behaviour because of the stroke. The son just started crying and screaming, "I knew it." How the heck he knew? We were all a bit freaked out. That is freaky. Oh my god. I was working at night and one of the patients died while I was in the room. We tried everything to revive this person, but it didn't work. So, after doing the papers and everything, I went to another place in the hospital, and I swear to God that this patient who I saw dead touched my right arm. I think that I have never cried that much in my life. Maybe it was their way of saying thanks for trying. One of the rooms we have is obviously having something of a haunting. A man in a gown gestured one of the techs to come in. She went in and he was gone. 1 week earlier, a female patient was asking to get a different room because a man wouldn't leave her room. We just thought it was some sort of delirium. Multiple others have seen him too. I used to work in a nursing home as both a CNA and an LPN, and while nothing too crazy happened, there were definitely things that happened out of the ordinary. I remember one time after someone had died, I was cleaning up her body, and then the door to the room swung open even though it had been firmly latched. Nobody was there. It gave me the creeps. There were instances of furniture being moved, lights turning on and off by themselves, and toilets randomly flushing by themselves as well. I also remember I had one resident one night who asked me to make sure I closed the door to the closet that was at the end of her bed, and she told me that when it was open, that woman kept going in and out of it all night and it kept her awake. When I worked at the funeral home, I was told a story about an elderly lady that had died. The husband said he wanted her to be buried with her ring as she never took it off. My co-worker was in the morgue and was washing the body. She removed the ring to mark it down on the paperwork. As soon as she did, a styrofoam head they used for wigs went flying across the room. She just said out loud, all right, I'll put your ring back on. No more disturbances. Whoa. I'm a psychiatric nurse. Early in my career, I worked at a residential mental health facility. There was a resident I'll call Marion Duchesne. He was an elective mute, which simply means that he didn't/wouldn't/couldn't talk, but there was no pathological findings as to why. He had spoken earlier in his life and in fact seemed quite normal back then, with the notable exception of being close to 7 feet tall. He'd also been raised in the Deep South and joined the military when he was 19. After boot camp, he was stationed somewhere in the south. One night, he just vanished. It was declared an AWOL for years, and finally he was declared missing and dead. 10 years later, a 7-foot-tall man walked into a VA hospital emergency room in my part of the Midwest and said to the receptionist, "My name is Marion Duchesne, and I've been dead for 10 years. Those were the last words he ever spoke. He was covered with dust, and he was wearing the same clothes he'd been reported to be wearing the night he vanished. His social security number had not been used, and he had no identification on his person. However, they were able to identify him, I guess via fingerprints. He was well fed and in good health except for his refusal to speak. The family was notified, but they said they had already grieved their lost man and that whoever was claiming to be him simply could not be. They said he was a haunt and a stand-in for their dead relative and demanded not to be contacted again." Marion paced all day, every day. Not in a frantic way, but just lumbering up and down the halls and outside. He smiled all the time and would be moving his mouth in a way that indicated talking or muttering, but he was dead silent. He had an unnerving habit of throwing his head back with his mouth wide open as if he were laughing heartily, but not even a breath could be heard. If I told him to go to the dining room for a meal, he'd go and eat, but if nobody told him, he just kept pacing, never indicating hunger. If offered a cigarette, he'd smoke it in an oddly formal way, almost delicately, if that makes sense, but he never seemed to crave smoking. The man wanted nothing. If I talked to him, he appeared to listen, periodically throwing his head back in that laughter mimicky way of his. There was nothing to do for this man. Various medications were tried, but they did not affect him either positively or negatively. Occupational therapy did nothing because Marion would just grin, and unless told to stay put, he'd get up and start pacing again. On my last day at the job, on my way to something better, the last thing I saw was Marion, pacing in the parking lot, throwing his head back to laugh. Later, I wondered if all along I'd been dealing with a ghost. All these years later, I still don't know. What was that? Oh my god. Marion Duchesne, okay. I'm a nurse in a hospital, and my patient was a well-known card reader in town, not too unheard of in Louisiana. I had actually gone to her about 10 years prior, and she was eerily accurate. While caring for her for a few days, I walked into her room, and she is unresponsive. She had been very lethargic all day, but now she was out. Her daughter is at the bedside and is trying to wake her up. I sternal rub her and inflict pain with no response and a very thready pulse. I call a rapid response. This woman then wakes up randomly and was full of energy within a 30-second span. She told me she was dead and watching me in the room the whole time, knew exactly what happened. She said God told her it wasn't her time and sent her back. She went home a couple days later, and she is still doing card readings. She's in her late 80s, if I recall correctly. A ward I worked on once had a patient who was a psychic/medium as a patient. We had a bit of a laugh with her as she was on the ward for a while. She'd had a stroke which affected her mobility, and she would do readings for the staff, etc. from time to time. I took it all as just a bit of fun until one evening when she pressed her nurse call buzzer and told us to go check on a patient in a side room as he was dead. We went to check and sure enough found that the gentleman had died. Later on we asked our psychic patient how she had known, and she told us she had seen him coming out of his room obviously distressed. She realised he had died and had to explain to him what happened and help him to pass over/go to the light. Now I am not a believer, but that gives me the creeps. She killed the patient. If she wasn't bedbound, we might have suspected her. Haha. Those two ha-has sound very nervous. I'm a nurse. I've witnessed quite a lot with Alzheimer people. They often develop their own scenarios in their head, often accompanied by vivid hallucinations. Once during night shift, I heard a woman scream in fear. Checking on her, she managed to climb into her wheelchair in pure panic, wanting to flee her bedroom. Asking what was wrong, she thought the building was on fire. Now, what's important to mention here is people often make claims that people are just crazy or dreaming badly or something, but this is not the case. People with hallucinations have been found to actually see, hear, smell, etc. something when their hallucinations occur, as the same locations in the brain are stimulated as if they would get real impulses. That woman actually saw fire. She actually smelled fire. She didn't just make that up to be crazy. It's what her brain told her was happening, and she was in real panic for her life. And the same applies to when those people see someone else in the room. When they want me to guide someone out of the bedroom who isn't actually there, seemingly standing right behind me, and it makes no sense to discuss with them that no one's there. To them, someone is there, and you better do your best effort of improvising to guide that someone, even if it's no one, outside. Play along, and they'll be fine. This, to me, is the scariest thing at work. They see something you don't. Working in a nursing home/long-term facility for multiple years, personally hadn't experienced anything too crazy apart from mystery call lights, call bell system going off, no buttons lit up, no rooms lit up, system would have to be reset from the electrical room to clear it, hearing doors close shut, toilets flushing, faucets running. These were by no means commonplace. Other staff had some more direct experiences though. Apparently in one hall a little girl would occasionally be seen walking. This had been reported by multiple staff as well as patients. A staff member was sitting out in her car during night shift when some woman knocked on her window and quickly disappeared. The next day she was discussing this out loud with the oncoming shift when someone pulled out a picture from old files based on the description provided. Apparently, it was a match to a former patient that had passed away at least 10 years before that staff member was hired. Oh, I have so many I don't know where to start. I work in geriatrics, nursing homes, for years, so most of our patients die within a few years of being with us. Anyway, I had a new patient move into one of the rooms on my hall that my previous patient had just passed in. My new patient kept calling at night saying there was this woman who kept coming into her room and trying to talk to her. At first I just passed it off, her being in her 90s and struggling with dementia, so I assured her that I would lock her door at night to make sure no one could come in. After about a week of this continuing to happen, I sat down with her and was asking what this woman looked like, thinking she may just be hallucinating her daughter or sister or something. And she proceeded to tell me that this woman had a pink robe on with blue fuzzy slippers and her hair up in curlers, and a woman would come in and sit at the foot of her bed, pat the new patient's feet and try to talk to her, but she couldn't understand what she was saying. I almost pissed myself. The patient that I had in the room prior to my new one went to bed every night in her pink house robe, blue slippers and her hair in curlers. It stopped after about 2 weeks. Okay, I am a nurse, but this did not happen to me, but several other nurses who worked at these units. There is a little girl who haunts the burns unit of a large military medical treatment facility in the US. She has been seen by both staff and patients. Haunts may not be the correct term, but she has been witnessed by several. Second, I used to work at the old Walter Reed Army Medical Center. In the old one that moved back in 2011, there was a VIP ward. I believe it was the Ward 72. Any retired general officers would stay there, along with any higher ups in the government, think Secretary of State and other cabinet officials. There was also a room for the First Lady and President. This ward is private, locked at all entrances and very nice. It is furnished with very high-end furniture, and a lot of it was donated by Mrs. Mamie Eisenhower, the wife of President Dwight D. Eisenhower. Well, per my friend who worked there, the ghost of Mamie Eisenhower is very particular about one staying in her room, and if anyone did sleep in that room, she would yank off the bed sheets. My friend also said decorative pieces would randomly fall off the table or fly off the walls when they were the only ones up there. Mamie would also apparently page the supervisor, who would call the ward back to a very confused nurse as to who paged them. Back when I was a paramedic in Oakland and I was taking care of an elderly gentleman in the back of my ambulance, he looked up into the upper corner of the ambulance and said, "It's okay, Lulu, I'll be with you soon." His daughter was with him and told me that Lulu was his wife, who died 20 years earlier. A few minutes later, he went into cardiac arrest and passed on. Ah man, this has happened to all my loved ones who passed away. The loved one who has been dead for years comes to get the person who is about to pass away. I guess I'll have a hot cup of coffee waiting for me with open arms when I'm about to die. I worked as a med tech at an assisted living facility. One day a resident, I'll call her Margaret, suddenly passed away, and her family left all her belongings in the room that night, including her pendant, to call the staff for help. The next night, Margaret's neighbour called the staff because someone was talking in the room next door and keeping them awake. We brushed the resident off, knowing that Margaret's room was empty. About an hour later, Margaret's pendant started going off from her empty apartment. I was the only one willing to go turn it off, so I walked into the room and it was freezing cold in the middle of summer. The air conditioning was off. Suddenly, the bathroom door slammed as I was turning off the pendant light. I locked the door and ran back to the nurse's station. We forced one of the older male staff members to go check out the entire room, and he claims the door was still locked when he got down there and no one was in there. You're just making me scared of the cold, don't you? Student nurse here. I once had a patient say, "Do you ever feel the chill whenever you're on a computer?" Don't worry, it's just a nurse who worked here a long time ago. She doesn't understand your technology, so she's trying to learn. I always feel someone is looking over my shoulder when I'm on a computer, so this freaked me out. You should just talk to yourself one night and explain the computer and how it stores all the info and teach her about it. See what happens. Maybe she'll eventually go away. She sounds friendly though. I had a 6-year-old who fell from a tree and had a significant head injury. She didn't respond to voice commands or painful stimuli, but she was having a conversation with someone. The only part I could clearly hear was when she said, "Well, I know, but I don't want to be dead." She then went unresponsive. Happily, the neurosurgeon was able to get her in the OR in time and take care of her epidural bleed. She survived with mild defects and came to see us after being discharged. She didn't remember the conversation at all. I am a psychiatrist, and during my training years I worked for 6 months at a ward treating patients with depressive and anxiety disorders. It was an old building who had been housing psychiatric patients since the mid-1920s. On our floor we had 13 beds and a nursing station, a living room and a few conference rooms. One day, a few weeks in, I am interviewing a patient who, when asked about sleeping patterns, tells me she has heard a baby crying at night, waking her up. There are no babies in that hospital, as the place is situated far away from housing areas and there were restricted visiting hours. Afterwards, the nurse pulls me aside and tells me that the baby crying thing is not a psychotic symptom. She is very serious about this but won't elaborate. I kind of shrug it off, as either way it does not change the diagnostic or treatment, and forget about the experience. Around 3 months in my stay, I sit in the nurse's station and 3 nurses behind me are talking. One of them says, "She is very active today," and the other says, "Really? Oh, hadn't noticed." I turn around and ask them who they were talking about. They look at each other, and then one of them hesitantly says, "Well, there is a baby here. She cries sometimes." I of course say no, but they just kind of shrug and smile. Not 30 seconds later, I hear it. It sounded far away, but not too far. A cry, clearly a baby's cry, sounding like it's separated from us by maybe 2 or 3 walls. I am perplexed and look at the nurses. They look at me like, "Told you so." I of course ask about this, but they can't say anything else except this faint baby cry is there and has always been there. Since then, I heard it maybe 2 to 3 times a week. I told a new doctor about it who laughed. However, a few weeks in her stay, she came to me, white as a sheet, and told me she heard it in their coffee break. All the nurses just kind of knew about it, and being in psychiatry, hearing that kind of stuff is not really something you brag about. I was transferred and haven't heard it since. I think about it sometimes. but I don't really know what to make of it. I don't know if that one's real, but whatever, good story. One day a patient had to go get an x-ray, which he was taken to in a wheelchair. About 5 minutes later, the notification from the patient's room went off, and me and my favourite work buddy went to the room. As we stepped in, we saw that the room was empty and the windows were closed. Even the bed was missing, in which the patient did not go to the x-ray. We both told a fully examined nurse, and even she had no idea where the bed went. At the end of it, we had to fill the room with another bed. I'm still a nursing student, but this was the most paranormal thing I witnessed so far. This one got me for some reason. Where is that bed? I still need to know, lol. Lol. My aunt is a nurse and told me some stories, but this one stuck with me. There was an old lady who insisted on being strapped down at night in her bed. She told my aunt that there was a dark figure that was trying to grab her and take her out of the room where she would die. My aunt and other nurses obliged, and for the next few nights she would check on her, and it would look as though someone was trying to pull her from the bed randomly while she slept. My aunt is then off, and whoever is this lady's nurse does not strap her down at night. Nurses found the old lady dead, laying on the floor by the door, her hands stretched out past the door and into the hallway. I'm out. Good night. Yeah, me too. Okay.